scene size up in primary assessment. I'm wearing my BSI. In surveying the scene, I see that I have one patient. There are no hazards, no weather concerns, one bystander. The mechanism of injury is that my patient was hit in the side of the head with a squash racket during a match. My general impression is that I have a 30-year-old Caucasian male patient who is awake and alert. When I entered the room, he turned his head toward me, indicating that he felt me coming into the room. I'm going to have my partner take control of the head, neck, and back of my patient, and I'm going to assess the level of consciousness. Come to the patient's side where the patient can see me, and I say, "Hello, I'm Philip. This is my partner. We're going to be taking care of you. I need to ask you a few questions." So I ask, who are you? Where are you? What day is it? And what events led to you being here? Now, given that my patient, Randy, is able to answer all of those questions accurately, I determine that his level of consciousness is awake and alert. At this time, I listen for breath sounds. I hear normal breath sounds, and given that he was able to answer my questions and breathe normally while doing that, I determined that his airway is patent and adequate with no obstruction and no adjuncts necessary at this time. I measure his breathing rate by watching his chest rise and fall, and I determined that he has a breathing rate of 20 breaths per minute. The rhythm is regular and the quality is unlabored. I now move to the pulse, which I take from the carotid artery for the appropriate amount of time, and I determined that he has a pulse rate of 60, and that at the carotid artery the rhythm is regular and that the quality is strong. I move to take the pulse at the dorsalis pedis, and at the appropriate amount of time I determined that the pulse here is also regular and strong. I return to the head of the patient, where I explain to my patient Randy that I need to do a brief check, and that in order to do that I need to cut away his clothing. So I take the racket, I cut away the shorts, I cut away the pants, and I begin the chunk check at the head, where I look very carefully to see if there are any fluids, any concerns, fixing as I find. I see none. I note that the patient's skin color is pink, and I begin to take the history through the sample method, and I ask about signs and symptoms. I ask about allergies, medications, previous medical history pertinent to this situation, the last oral intake, and the events leading up to this moment.